I have the honor of facilitating today's discussion with four impressive women in revenue cycle, who I will introduce momentarily. First, I want to acknowledge our audience, and what an impressive turnout. I'm thrilled to see your attendance today. It includes those in revenue cycle and healthcare finance, CEDAR employees and friends, and CEDAR clients. Before we dive into today's event, I wanted to share a bit about how this event will be structured. We will be taking questions from the audience, and we really do want to hear from you. So please chime in within the Zoom chat thread. That way, the panelists and I can fold these into today's discussion. The event will conclude in about an hour. Now, let's introduce our esteemed lineup of four remarkable women who will be discussing leading with resilience and empathy during a public health crisis. First, I'd like to introduce Mary Daymont, who will be going by Mary D today, since we have two Marys. Mary D is Vice President of RCM and Care Management at Children's National. Since 2002, her responsibilities have grown to envelop patient access, registration, patient financial services, and care management. A nurse by training, Mary was inducted as a fellow in the American Academy of Nursing in 2018. And she also works with Children's Hospital Association to develop policy and advocate for our children. Mary Beth Remorenko is the Vice President of Revenue Cycle at Mass General Brigham, where she is responsible for a team of 800 people. Mary Beth has over 20 years of healthcare management experience, spanning management consulting, hospital operations, analytics, and finance, and she serves on HFMA's National Large Health Systems Revenue Cycle Council, and is also on the MBA Healthcare Advisory Board for Simmons University. Next, Kelly Searle is the CRO for Sound Physicians, where she leads a team of skilled revenue cycle managers, operations, management, analytics, and strategic planning. She is also a professional mentor, working with female executives to bring their authentic selves to the workplace. And she's author of the book, The Naked Executive, and has been honored to be invited to speaking at high-profile events such as the Walmart Women's Leadership Summit and Dress for Success International. And last but not least, certainly, is Kelly Black, who leads Revenue Cycle for Novant Health Medical Group. Kelly joined in 2000 when Novant Medical Group was just 30 clinics and 75 providers. Today, they've grown to 650 clinics and 3,000 employed providers. Over the years, she's consolidated multiple business offices, integrated other health systems, and under her leadership, Novant Health Medical Group has received HFMA's MAP Recognition Award for RCM performance. With that being said, we are so thrilled to have you here, and we have a great lineup of questions around leadership, your career paths, COVID-19, and revenue cycle too. So thanks for being here, you all. I'd like to start up with some questions around career path and leadership. We all are aware that healthcare organizations typically skew somewhat male. And as experienced revenue cycle managers, how do you view the role of a female revenue cycle executive? And how do you personally approach leadership? I'd love to start, Mary Beth, if you'd like to take the mic at first.
Sure. Thanks, Stephanie. And really such an honor to be here today with this group. I think in terms of leadership and revenue cycle, I think it's a great opportunity for women leaders to show that they can be strong in areas such as finance, accounting, strategy, areas or functions where historically they may have been male dominated. So I think that is definitely one of the advantages of rev cycle in women's leadership. But the other one would be having an opportunity to have such an impact on the workforce. So in revenue cycle, there's such a human aspect. What our biggest asset are our teams. And so it really does force us to take a look at ourselves on a daily basis and what type of leadership are we providing. And whether you're a man or a woman, you need to balance your career. And I know as a mom of two boys in elementary school, how challenging that can be. And I think, showing that you are an individual, and that you're approaching leadership from a place of compassion is definitely resonating with people and with my team.
Thanks for that, Mary Beth. I love your mention of compassion and the human aspect of things. Kelly, would you like to chime in on that question too, or the element of diversity as well in the workforce is something that Mary Beth alluded to as well? Would love your thoughts on that too.
Sure, absolutely. And, I agree. Mary Beth, you made some great points about, traditional characteristics that revenue cycle's been known for, and it's finance and accounting and while those are great professions and are great skill sets that people need to have, in the last 10 years, as revenue cycle and patient care and healthcare has changed so drastically, it's been a great opportunity for female leaders that can step in and be innovative and use creativity and bring some of those types of whole centered leadership, what I call wholehearted leadership and vulnerability, and still deliver on the results, right? And I think from a leadership standpoint and how I'd lead my teams, which I say is, we lead all of our stakeholders. It's about influence that you have within an organization, not tenure or title. And that's phenomenal from a change I think that we've seen over the last 10 years, which leads great into diversity, inclusion, and belonging, which I think this year has been radical. We've seen a lot of focus on those. Sound has really stepped up to the plate, and we're really focused. We've always been focused on having a diverse workplace, but the work that we're doing now is with the Neuro Leadership Institute. And we're really stepping things up with our executive leadership team to, change the vocabulary that we're using. We're using, diversity is having a seat at the table, but inclusion is having a voice at the table. And those could be two very, very different things. So incredibly proud that it's not passive action and that we're just, using those keywords and buzzwords in our marketing material, but really embedding that in our culture and who we are, from clinical leadership and as well as our business operations.
Yeah,
Thanks,
Kelly, I think you made a very good point that it's not just buzzwords. And I think Novant has made a concerted effort over the years around diversity and inclusion. And that's one of the things that struck me. It's not just a buzzword at Novant. And this year has been difficult. And I think Novant, because of our focus for many years on diversity and inclusion and integrating that all the way down to the team member level, that we were able to have difficult conversations during this difficult year and be comfortable with that. Our executive leaders set that tone and started Zoom chats for team members and others to have the difficult conversations, but we were actually able to replicate those conversations within our own teams and feel comfortable because we had the background and we had that lens and that focus for so many years that it made us comfortable being able to have tough conversations that were just so relevant this past year.
Thanks for mentioning that, Kelly. And what kind of proactive investment in D&I internally have helped you serve your customers and patients? Certainly, it's not just a buzzword, it's not a marketing term, but I'd love to really hit on some of the specific efforts that you've made to address maybe underrepresented populations in your industry while hiring.
Well, and we're taking it to the next step and being very intentional where we're sourcing resources. It's not just characteristics, but it's really expanding that into inclusion. Because you do get into a specific rut, you start to recruit from the same pools, you get referrals from people. And the seeds model that we're really looking at is one of the admitted biases. The number one most familiar one is similarity. And it's an unconscious bias. And the number one way to battle bias is to just step up to the plate and say, we have it, to train on it, to be aware of it. And as you start to be able to have a safe place to have those conversations. Am I looking at people that are similar, right? Are we in such a hurry that we're looking at experience bias? Okay, my experience has been people with these characteristics have been successful. Am I willing to expand that bias? And I think just by being aware, it really gives you the opportunity to change things. And no football team has all quarterbacks on it. Diversity and that creative conflict and constructive, way that you can put together people that are very diverse makes a stronger team. It just does, bottom line.
One of the things that when you mention inclusion and having a voice at the table is really including panel interviews that include staff from diverse backgrounds. So you're really giving the front line a voice and who's being hired. And it's been very, it's something that I've done a lot with some groups, but not others. And now we're doing it with all groups. And I'm always so impressed at the amount of great feedback that the staff provide as part of that process. And then they also feel that whoever is hired at the end of the day is someone that is going to be a good fit with the rest of the team. And I smile because we use behavioral interview questions. And my favorite question is, tell me about a time when you were able to influence another person to change a decision, because leadership is all about influence. And we want everyone to feel like they're a leader, no matter what level of the organization they're in.
Thanks for mentioning that, Mary D. You are mentioning some things around behavioral economics, similarities, unconscious bias. Another element too is certainly development. What are the experiences that people have, right? And so one thing you have to think about too in hiring is like, what if the resources that you're looking for, they don't have the experience that you're looking for too, if you're also seeking diversity. So another question, kind of pivoting a little bit from diversity to career development, is how you think about guidance and support in both developing your employees, and then also how you were developed as an employee and how you advanced within your career. So along that vein, I'd love to know how you've thought about mentorship, and if you'd like to share also different ways that you've been mentored as you've advanced in your career, that would be great. And Mary D, if you want to continue along that vein, I would love it.
Yeah, it's like, I just so much want to hear from Kelly. So I feel like I'm just kind of, because obviously Kelly is very, very developed in the area of mentorship. It's interesting. The mentors that I've had in my career have been all kinds of backgrounds. Probably one of my favorite was a very surly man who was the leader at Kaiser over a large medical facility, and had been formerly a Korean MASH officer. And he really taught me how to be concise in my direction. And despite his burliness and his exterior, he was so genuine and authentic and kind on the inside. It really showed me you can't judge a book by the cover, and that you can be firm and hold the line and still be very compassionate and empathetic in doing that. But I would love to hear some guidance on being a good mentor from Kelly. So.
The one thing that I've learned, the best mentors I had are people that I decided I never, ever, ever wanted to be known for the characteristics that they had. So I think, every interaction that we have, I call those souvenirs. Like those have been some of the best mentoring situations that I've had. And when I've put together things, I never want to be that person that if I call someone out of the blue, that they look at their phone and go, oh my gosh, why is she calling me? And they don't even want to answer the phone, right? And that really goes to that other piece of bias, which we have a safety bias. So I tend to think that people want to be honest and give you feedback and interact with you whenever you have a relationship with them. And the way to have a relationship is to spend time and invest in and actually be honest with people and give them feedback with kindness and compassion. Because without that, it's just cruelty. I know it's a cliche, but it truly is true. And I tell people, if you want to have a culture of feedback, then build a culture of relationship, right? Talk to people about who they are. And I think that if there's been something that's been really transformational this year, the work from home and the remote, we see more of our personal lives. The boundaries are just not what they used to be. You go to work, you can put that fine line. So, one thing that I've personally, really been challenged with is that I do see more of the pain and the struggle. And I used to be able to turn it off, I think, a whole lot easier. I'm not sure that made me a better leader. And, now I feel like I have a much stronger connection with a lot of people that are on my team just by seeing who they really are. in that. And I show them all of mine. They see it. I mean, they see my stuff in the background. They hear my dog bark. I mean, there's just this human aspect of doing that. And it's never to be who you're not, right? I'm clearly not a traditional, accountant in finance. I admit that. And when I walk into a boardroom in New York City, the way that I present to my audience is radically different when I walk into a boardroom in East Tennessee. And I don't have a problem with that, right? I mean, it's just, I know that I can style flex. I work on that and I mentor people with that. But never, ever, ever do you have to change your message. It's truly just the way that you communicate the message. That's it. And for influence within organizations, it is all about learning that lesson. And I think that that's been, and being a good mentor, it is, hey, you don't have to be anybody else, right? Especially as a female leader, I've heard people will kind of be, I'm too direct. People think I'm too aggressive. People think, I think that that's a common theme. We probably have all had that said about us at some point. I'm like, well, if the hospital's on fire or if something's going on, by gosh, we want you in there. Like there is nothing wrong with being direct. But let's talk about some specifics, right? About the communication style in this situation.
That's such a great example, Kelly, of some of the skills that you've developed. One question I have, just to dig into that a little bit more, is how do you think you developed that? Did you learn it through learning by example? Did you learn it just through practice? And that really translates to all of you. Kelly Black, I'd love to hear from you too. You all have grown in your careers and you've been in your positions oftentimes for decades, right? How did you flex and grow in your roles too? So Kelly, if you want to start, and then maybe Kelly Black, if you want to continue, that'd be great.
I think it's trial and error. Like I've got some souvenirs that I just, sometimes our batteries are running low and you shoot an email out when you shouldn't have, and you make assumptions when you couldn't have. And, it's just like being a parent. And so just hat in hand, you just have to just know that it's going to take time to gain that credibility back when you do that. And that for me, I just call it a souvenir. That's
a good way to put it. I think some of our hardest lessons are learned that way. And you can be very embarrassed by some of those lessons. But I also think that as long as you lean into it and you realize there's something to be learned from every experience, and you look at it that way and you consciously think about it, you can't help but grow. And I will say that while we have a formal mentor program within the revenue cycle at Novant, I am a big proponent of more of an informal mentor. And that is what has worked for me over the years. And that is really being intentionally observant of leaders. And also, Kelly, for those that lead the way you want to lead and those that lead the way you don't want to lead. And I have gotten some of my best ideas by watching other leaders who are successful, their mannerisms, the way they handle conflict or stressful, difficult situations, and really trying to emulate those behaviors, watching how others react to them. And if it's a negative reaction, I know that may be a behavior I want to stay away from, but if it's a positive reaction, you can just learn so much by paying attention to other folks and how people respond to them if you really want to grow and learn. And I try to pass that along to the people that I lead and that work in the revenue cycle to just watch those who are really successful, because that people who react well to them, that's just giving you a free roadmap of what you need to do to also be successful.
Thanks for your thoughts on that. Any other thoughts on career development or mentorship?
I just want to piggyback on what Kelly Black just said in terms of the informal mentorships, because I've also had that experience where I'm part of both formal and informal mentorship programs. And there's just something really special about the informal situations. From a formal perspective, we also at Mass General Brigham have formal mentoring programs. And as Stephanie mentioned, I volunteer at Simmons University as an alum and advising their programs. But there's something about, when you interact with someone that has a ton of potential, and the ability to really encourage them. And that's I've been fortunate in my career to come across several mentors of my own. And that was my experience with them as well, especially when I had doubts about my abilities or my capabilities. Sometimes people just need that extra push and that extra word of encouragement and support. And I'm just really thankful that I've had that from mentors, and even some of my college professors in undergrad or grad school, encouraging me to go for the big jobs and to take the chances and take the risks, because you may surprise yourself, and you may be better than you thought.
That's such a great note, that it's incredible what you can do when you realize that someone else believes in you too and can build you up, right? I'd like to transition a little bit to obstacles you've dealt with. COVID-19, we all know, has been incredibly challenging. It's also been a really defining moment. And I certainly want to touch on it, but you guys have a combined like 45 plus years of experience in the revenue cycle industry. And you've no doubt had a ton of experiences and challenging moments before 2020. So I'd love to take a step back in history and see if maybe you all could touch on some of the challenges that you all have had and how these experiences have prepared you to lead in our present time. Mary D, would you like to start?
I was going to say, it's like challenges are like an everyday occurrence, it seems, and especially in 2020. One of the things that I always impart to my staff, and I do believe, like, as a leader, it's always good to have like a consistent message. I love Kelly's souvenirs. I think that's a really nice way to, package thing up, to say, don't own it, don't internalize it. It's your souvenir. You've learned from it, take it with you, but it's a souvenir. You put it on the shelf and you keep going. And mine that I always tell my staff is every adversity is an opportunity. And so I kind of approach challenges in that way. And I encourage my team to, because, in revenue cycle, particularly in tough financial times, a lot of adversities can be thrown your way, some predictable and some not. And really, every adversity is an opportunity for an improvement and to come out the other side with a better plan and just a better situation. So that's kind of been how I've approached challenges throughout my career. And again, they're so numerous, I wouldn't even know where to start. So I'll switch over to Mary Beth and see what she has to say.
Yeah, so in terms of challenges, I think there's been so many. I think that in terms of how they helped me lead through COVID-19, I think, as you said, looking at things instead of it being the glass half empty, half full, and looking at it as an opportunity. I've really seen the past few months as an opportunity to demonstrate my leadership to my team and be more involved, be more hands-on, be more present, be more visible, especially during a public health emergency. I think people and their stress levels are just through the roof. So I think that it takes judgment sometimes to realize as a leader when your team needs you, and when you can show them that you really care and how you do that. And for me, part of that has been being more engaged and more involved and more visible, and making sure that they know that I'm available when they need me, and they don't have to have the weight of hard decisions sitting on their shoulders alone, that we're there as a team.
That's great. And Kelly Black, I'd love to hear from you. I know I mentioned in the intros how incredibly you all have scaled as an organization. And I imagine that's not always been easy. Would love to hear your thoughts about some of those challenges and how you approach them.
Yeah, thank you, Stephanie. It has not been easy, and anyone who knows me probably knows exactly what I'm going to say. But about 10 years ago, we had a series of 3 very big challenges that I will tell you that nothing's happened since, including this year with COVID, that has topped those challenges. And that was one, we were consolidating business offices. We had 2 acute and 2 ambulatory business offices, and we wanted to go down to 1 of each. And I had the physician business office, and I had to bring an acute business office into my business office. The physician office that was in the other region integrated into the acute business office, which had a different leader. There was nothing, I thought we had everything technically arranged, from training and policies and procedures, and we had it all aligned. We had consultants that would help us, and I would have said we were prepared. We didn't take in the cultural differences between an acute revenue cycle and a physician revenue cycle and what that really meant. It took us a long time to overcome that challenge. That was probably one of the most difficult things I've ever done, but probably that's colored by the fact that in the middle of that, we had 3 practice management systems that we were going to consolidate into 1, and it failed. So then we had 4. And we were continuing to grow. And so we had to allow practices to come up and keep their existing billing system and use our tax ID for billing, which anybody in the revenue cycle knows what a disaster that will be when it comes to payments, how we got paid and who got remittances. And so I was missing tons of millions of dollars worth of remittances. So I couldn't post payments to the account. And by the way, we decided to integrate another health system at the exact same time, which brought, I can't remember exactly, maybe 40 or 50 practices all at once in the middle of this nightmare. And I will tell you, the only thing that kept us together was, as Mary Beth said, I had to be present. I had to remain calm. Inside, I'm like, I don't know how we're ever going to recover from this. I don't know what to do, but I couldn't let the team see that. I could be transparent with them that this is tough, this is difficult. We've made some mistakes along the way that we've got to fix. Now let's, I hate to use a cliche, but let's, serve up this elephant one bite at a time. We can fix one thing at a time, and let's be calm and realize where we are and continue to keep our leaders apprised of the issues and the challenges and making sure that we could explain them. We come through that when we implemented Epic in 2011. And as you mentioned in the intro, we're able to even overcome to the point that we got a map recognition award, but it took being calm. I will tell you that's made the team members and my leadership team incredibly resilient. And I do think that those experiences did help us as we were faced with the challenges of this year.
I love that. Stay calm and carry on. I'm glad you didn't reference the CEDAR implementation as one of your biggest challenges aside from COVID. With that, I want to remind everyone that you can put questions in the chat. But it looks like we have one chat question that I'd love if one of you would like to take. What advice would you give based on informal mentorship and boundaries? Which is an interesting one, particularly where we don't have the same physical boundaries we used to have between home and work.
That makes me laugh because I've been mentoring a lot of millennials lately, and man, once they get your cell phone, they text you anytime of day or night, ask you questions, pour their souls out. So that's a really, I always felt like, in the pre-COVID kind of, in-person world, it was much easier to have boundaries. And in this like COVID, as Kelly pointed out, like everything's out there now and we're much more intimate than we ever were before. And then you add on top of it, those millennials and their 2-thumb texting that's so fast. It is a challenge. And so the way I kind of deal with it, it's like, if it is something I can tell that it's really urgent and important to them, I will absolutely address it. Otherwise I do try to keep a boundary between work time and personal time and just choose on when I'm going to engage and answer that, text message that comes, like I say, any day or night. And then if it's something that's really significant, I will ask for an in-person Zoom meeting with the individual, just so that I can really, hear what it is that they need from me and respond to it. And that way kind of, helps put some boundaries around it, especially with the text messaging. And I don't know if any of my other panelists have had the experience of the millennials that, just put you on that speed dial with text, I tell you.
I haven't, but I won't be giving out my mobile number anytime soon.
I did in my email at, it's just, with the way it is, that's kind of the day of the society. But I would say, yes, keep that email, keep your email with your work number.
One idea would be to focus the mentorship on a specific goal or a specific type of achievement, whether it's work related or whether it's, development related, to kind of try to establish a boundary in that way in terms of kind of what your relationship is focused on. That may help in terms of developing a boundary and prioritizing what you want to talk about.
That's
One of the
idea.
power questions that I always ask people when I'm doing mentoring, which I prefer much more because it's informal and not coaching, and that's why I really lean toward mentoring, is, sometimes people just want to like vent, right? And so I always step back and say, well, how did that make you feel? And sometimes people are really taken aback by that because, I'm looking for a word. And, when people start, then it's almost thinking out loud. Well, I wanted to, okay, but how did that make you feel? How did that make you feel? And when you finally get down to that one word that they're challenged with, they're dealing with, then that's what we focus and mentor around. Sometimes it's, most of the time, right? Fear, inadequacy, uncertainty. And so then that's what we coach around is, okay, so now let's talk about what the trigger was that made you feel that way. All these other things you want to talk about are just like details, right? It's, you got a trigger. This is how it made you feel. And this is what you've historically done. How can we change those actions that are resulting from that trigger next time? And that's, how change happens.
I love that, Kelly, Searle. So I'm hearing I love the idea of focusing on a goal or achievement and then really drilling down into the so what to try to capture what you're saying, Searle, to really get to the source of the issue, to really be able to be helpful and also measure your results. Did you achieve whatever that goal was with mentorship or what have you? I'd like to transition a little bit to COVID. Certainly, we're working on things like fostering remote collaboration amongst our teams with work from home. And all of our organizations have been impacted. Healthcare organizations, arguably the most, right? And so one thing that I have a question around is really your operational models, to move to more of a business lens a little bit. So I'm curious how you've had to make adjustments to serve patients during this time and how they're going to be lasting, whether it's work from home or just more broadly, different changes that you all are addressing operationally due to COVID. And Mary Beth, would you like to start, or Kelly Black?
Yeah, I will. So we had to, like everyone else, abruptly evacuate our corporate headquarters and work from home. And revenue cycle, we had been dabbling with remote work for many years, but not all of the teams. Coding is an area where we've historically had working from home previously and had, thankfully, a lot of experience under our belt with that. But for some of our teams, specifically, and this may resonate with some others, cash posting was not something that we typically did from home for a variety of reasons. But we had to figure it out very quickly within days when we moved all of our teams. I think that, as we talked about earlier, seeing those obstacles as challenges, I actually think that my team is even stronger now, similar to how Kelly Black told her story of, facing adversity and getting through it. I think that, we have been up and running and successful. And to quote my boss, Peter Markell, our CFO, we haven't missed a beat. And I think that's a tribute to the team and how resilient they are. I don't know that we've completely figured out working from home and working virtually. I would say it's working really well so far. we've been working really hard to try to foster our collaboration and to try to make sure that we have processes and structure around our new environment. And so some of you have probably also experimented with Zoom chats. We have weekly coffee breaks. I think people really, they miss those informal opportunities to network with their peers and their colleagues and running into people in the lobby and the elevators. And so we tried to recreate that a little bit through, setting up little networking Zooms and picking a variety of topics just to have, some personal connection time with people. The other thing is we had actually just rolled out an employee recognition program prior to COVID, which was good timing. And we've continued that. So I have a quarterly town hall. We've continued those. And we do now recognize a staff person, and we're getting ready to roll out a manager program as well. Who it's called a revenue cycle MVP, someone who hits it out of the park. And we have nominations from within our team, from other peers. And that really means a lot, I think, in terms of fostering the collaboration, that we have an infrastructure or a process around recognizing each other's strengths and recognizing each other for that. And for me as a leader, sending the message to my team that that's important to me. And it's important overall to our entire department.
That sounds like an incredible program, and what a great way to acknowledge people when we're not seeing each other every day and there aren't those micro opportunities for acknowledgement. And same with collaboration. Cedar does similar, like coffee chat type things too. Do any of the rest of you do similar programs around recognition or trying to come up with informal ways for socialization and connectedness, given the COVID work from home environment?
So we actually do a weekly newsletter, and in the weekly newsletter, we recognize work anniversaries, birthdays, educational achievements, because people have continued to grow in 2020, as well as, special thanks. And what we really strive for is that peer recognition that Mary Beth spoke to. I think that's so important that that staff feel like that their peers are recognizing them, and it's not a leader that has to always do the work. And, every week we have a different team that's really, or a different group of individuals that have been recognized by physicians, by healthcare providers, by some of our payers. So it's really been that weekly. I will say that I have a project manager who does all of the beautiful work. It is a production to do it on a weekly basis. I would say that.
I think the only thing that I could add, Stephanie, is that, and I was very fortunate that more than half of my revenue cycle team was already working from home pre-COVID, and we were already poised to send more home. So we were able to rapidly get folks home. It was difficult with cash posting. We had to come up with some workflows on how to handle some of the paper in the office. But I will tell you one thing that we found quickly is we had not set all of our team members up with cameras. In our pre-COVID work from home program. Some had them on their laptops, but not everybody. And we realized we had to do that because they still needed that connection. They needed to be able to see each other to feel more connected than just seeing a picture or of hearing a voice. And so that was one thing that after we got everybody home, we began to order cameras for everyone so that we could do some of these programs. We recently had RCS, what we call RCS, or Revenue Cycle Week. And that's a big event that we always had in person, obviously, before. And it was challenging to figure out how to play games with that many people online and how to come up with different things for everybody to do to feel connected. But fortunately, we did have our cameras by then, and we were able to pull it off. And so I think that was the only thing that I would add is it is really important to have cameras and let them see each other and be able to have those conversations similar to what they were having in the hallways pre-COVID.
So as a quick question, have you guys made that standard, just to the other, panelists? Is it standard that all of your meetings are on video? now, because we've always had them, but we rarely use them, right? We were not a culture of turning our cameras on pre-COVID. And now if someone wants to do a conference call just on the phone, I'm like, I have to dial a number? Like, no way, send me a link. Like, I just need to hit my button. Has that become standard for you guys? Cameras on?
We're using Zoom and Microsoft Teams mostly.
Okay.
So I would say the majority of people are using their cameras, but it's definitely something we've been talking about is not all of our staff use their cameras all the time. So we've been trying to talk about, should we be establishing some sort of guidelines on that? For now, the way that we've approached it is we've just encouraged and we've kind of put in the subject line of the meeting, cameras on, please. Just if it's a meeting that, you know, we'd like to have face-to-face interaction, but there's plenty of meetings that are just more updates where it's okay, you know, if folks have their cameras off while they're eating lunch, etc.
Yeah, it's not always good to have your camera on while you're eating lunch. It also goes to the question around boundaries, right? There's a different level of intimacy with having your camera on, right? So there are times at which it's appropriate, right? But it depends on the culture of every organization too, which leads me to the question around like the operations that have changed, for example, work from home. I'm curious if you think there are some shifts in operational business models to serve your patients specifically that you think might last or might emerge as a result of COVID. So we're talking certainly about how it's impacted our workforces and your teams. And I'm curious how the impact has been on your patients.
Clearly, we did a very rapid migration to telehealth. It went up like thousands of percentages. I mean, you know, it was pretty amazing. And I think that's a great business model. I think it's a real customer satisfier, and I think it's going to stick. And I think our physicians like it as well. The one thing that we're really trying to do better at is the touchless registration process. You know, there's too much touch in the current for patients that have to come into our medical centers. You know, it would just be really nice if everything was done and they could just literally, you know, click on here and the person behind the plexiglass say, great, go to room 3, and have that be like all of your insurance verification, patient identification, have all of those things ticked and tied before the appointment. So we're working very hard to ramp up those sort of self-scheduling type of processes. And we hope to formally, you know, begin launching something early next year, which is really quite honestly, like, you know, 9 months too late, but.
Yeah,
That's
just
great.
to add on to that, we're also focusing more on digital, the digital patient experience. And, you know, we've been working on that for several years. And thankfully, sort of just in time with some of those features and functions that we got for COVID in terms of enabling the telemedicine visits. You know, we have something called e-check-in turned on now. I know I just uploaded a copy of my insurance card myself a couple weeks ago. And so I think it's definitely shined a light on the fact that as leaders in revenue cycle, we've known this for a while. We've been working to address it, but there's still a lot of unnecessary steps and unnecessary processes and workflows that are administratively burdensome and burdensome to patients and providers. And so I think the more we can sort of fine tune and refine those processes and move things to self-service, like Mary Daymont suggested, I think that those things will stick longer term.
Definitely. It's great to hear you all mention the self-service tools. And I'm curious how you prioritize all these elements of digital strategy, right? You know, Mary D mentioned, hey, we might be 9 months too late on this touchless registration stuff, but we've got to do it. There are all these competing priorities. So I'd love to hear your thoughts around when you think of your digital strategy when it comes to patient experience. How do you decide where to start and what the urgency is and what to fast track versus what to kind of plan out for future quarters?
So just for some level setting, I'm having Kelly Black's year this year. We actually went live with the Cerner revenue cycle system on October 1st. I had to bring all my staff back in for training and go live. So that's been a very big experience with plexiglass and safety and distancing. And it's been a lot to try to, again, roll out a new system, which is the main reason why we had to postpone all of our sort of, front end digital experience until January, because we really need to get the system, up and stable and everybody comfortable with it. So, so our priority was, again, having a system implementation and making sure that it was successful prior to this. But in the meantime, we do have a patient-facing technologies committee and a lot of work on the portal and COVID results and just how to make that interaction easier. So that's kind of my backstory. So this will be the year, Kelly, that will be the year.
We'll define the year.
It is, for sound, we being hospital-based physicians, including being in the emergency department, we're relying on the hospital for all of our patient demographic information. And of course, we, like everyone else, embraced telehealth very quickly. So that limited contact that we did have with patients was even more limited at that part, especially in ICU. So we really have focused on, we've always been trying to communicate after the fact with patients post-discharge, doing that not via snail mail and sending statements. So we've really tried to focus on the behavioral analytics of how are these patients responding, what are our demographics, what time are they making payments, what kind of messaging, what kind of wording are they responding to? Can we send, for a Blue Cross Blue Shield patient that owes a deductible of less than $150, we send 2 statements and divide it out into 3 payments. And with COVID, the opportunity to be more compassionate, it's, we've changed the wording on some of the messaging that's going out. We've extended the payment terms for people. We're really looking at our portal and our outreach as an opportunity to engage with patients, not to bill patients. And I think that mindset is, just a game changer for people. So it really is about patient engagement. We tell people from the bedside, all the way to adjudication of the claim. It's all about the patient experience there.
Yeah, and for us, also, it's been the patient experience, and then particularly for the revenue cycle, the patient financial experience. And I think, there's lots of different surveys that have been out there over the years. And I think one of the main things that patients don't like about healthcare billing is the lack of transparency and the fact that they don't understand and they don't have an idea of what it's going to cost them or what their out-of-pocket liability is going to be ahead of time. So that's been one of the areas that we've been wanting to focus on, is for transparency and surprise billing. And working on how can we provide estimates to patients. And I think that dovetails with financial counseling and financial assistance as well, because if you're giving a patient an estimate and they have a large deductible or a high unexpected out of pocket, part of that conversation is about providing assistance to the patients. And I think especially with COVID, we've relaxed a lot of our policies in terms of, turning on collections activity and things like that. We actually paused it for several months during the height of the initial surge in the Boston area. But I think financial counseling, financial assistance, any sort of programs that we can be proactive about, it helps us and it also helps the patient. So we'll be focusing on those things.
Thanks, Mary Beth. I hear a lot of focus that you all have both on leveling up your teams and leveling up to better engage your patients, and really commend you for all that you're doing during this time. I also hear a lot of empathy in how you're approaching these challenges. And the COVID-19 pandemic has caused a whole lot of financial hardship for people. It's also caused a whole lot of hardship for employees having to come in for training, for example, Mary D, in the midst of a pandemic, right? And so one thing I'd like to understand is how your organization was addressing meeting like a diverse set of member and patient needs with an empathetic approach. And Kelly Black, I'd love to start with you. You were telling me before we met around the Hope for Remarkable Team Aubergine project, and I'm wondering if you could tell us about that.
Yeah, I will be happy to tell you about that. The Hope for the Remarkable Team Aubergine, and aubergine is one of our brand colors. It's not purple, it's aubergine. And so this is a fund that our executive team come up with. It was funded by Novant Health, our own executive team members, other donors, and by team members themselves. We raised over $10 million for this fund. It was for Novant Health team members who were undergoing hardships due to COVID, whether that's their hours had been reduced or whether their spouse had lost a job, whether they needed temporary housing while they were caring for patients and didn't want to expose their family members, or whether any financial need that hit them, they could apply for this fund. And it was remarkable to see the number of folks that donated to the fund, but it's been heartwarming to be part of Novant and see how many team members we have truly helped. We've already awarded over $7.5 million of the fund out to our team members who were struggling during this time to help them feel supported through this. It helped with childcare, any of the challenges that we've all heard about around COVID, and makes me incredibly proud to work for Novant. I will tell you, in the revenue cycle, we were extremely fortunate that we did not have to reduce hours, and no one had to take mandatory PTO in the revenue cycle. But we were very aware that there were team members who were impacted, and I had team members whose spouses were impacted. So they still had a financial impact and a stress on them, that this helped know that the company that they worked for cared for them and continues to care for them. The fund is still active and alive and still helping our team members today. So.
Thanks for sharing that. That's a great example of leading with empathy and compassion with your employees.
I think
Drilling into,
I was going to say,
please, Mary.
Kelly's comment talks about too how like often empathy begins at home. And if you are empathetic with your team and your staff, and you show them genuine empathy, they turn around and treat our clients and customers the same way. So, you know, we do have a huge focus on employee engagement across the organization. But even now, more so in this time, you know, working with each individual to make sure that you're balancing their needs in this kind of crazy environment we're in is how you start kind of bringing that home. So I thought I really appreciated Kelly's example.
Thanks, Mary D. Drilling into revenue cycle priorities in light of COVID, I'm curious, thinking about this space, I'd love to get your take in one word, or you can do three if you want. Where do you think the revenue cycle will be in 5 years? Like maybe a few attributes that you might want to share. I'd love to hear from each of you on this one.
I'll start and just say that automation is a big buzzword in revenue cycle right now. I do think that we're going to see more artificial intelligence and more automation, more of a digital workforce in the next 5 years.
And I'll throw out it value-based, right? We are going to be more at risk for, you know, financially for outcomes, and partnering hospitals and providers together with payers. I think that 5 years from now, we will have a huge transformation from fee-for-service leaning to value-based reimbursement.
I'd say flexibility. I think that especially during an emergency, people are asked to do things that maybe they wouldn't normally be asked to do. And I think that it's really important to give ourselves and our staff the permission to do things in a different way. But I think the revenue cycle of the future, we're going to have to continue to be adaptable and flexible, operationally, financially, in terms of our skills and our capabilities, because I think that's the direction RevCycle is heading.
And I would just say clinical integration. I think, you know, more and more, I mean, we know that we exist because we are billing for clinical services. And I think that alignment, speaking to, you know, Kelly's point about value-based care, I do believe revenue cycle and clinicians need to be locked arms, marching in the same direction towards the same outcomes.
Thanks, Mary D. So your clinical integration, flexibility, value-based care, automation, in light of the CMS new rule on full transparency, I'm wondering how you guys are preparing for price transparency and what's your strategy around that? And how also does it fit into this kind of future role of flexibility, integration, and things like that? How do you think about transparency within this nexus of these descriptives that you just shared?
So I'll start on that one. We've been working on our getting ready for price transparency for quite a while. About a year and a half ago, I think we did an industry presentation on it, and we are on Epic. So we've engaged with Epic for their assistance to create what they're calling the big file that we're all required to put out on the World Wide Web January 1st. But as I was talking about digital and patient experience, the good news is we had already started working on that. And so our patient estimate and transparency, it actually dovetailed nicely with this requirement to have the 300 shoppable services available to patients, because that was already sort of our plan to do that, because we thought it was the right thing to do for patients. And so we just had to accelerate it and reprioritize certain aspects of it. But a few months ago, we went live with the Epic Estimator tool, which is really our primary way of meeting the requirement on the shoppable side. And then we've been working on making our CDM and our pricing more transparent. Overall, I think our strategy is to try to continue to work on this after the January 1st deadline and take a strategic approach to it. We really want to see if we can potentially rebalance. So there are certain services that, you know, we don't even cover our cost to provide. And we'd like to see some of those rebalanced with maybe some of the other more favorable services.
Thanks, Mary Beth. Yeah, there's certainly a difference, right, between transparency and meeting the requirement and then meaningful transparency and taking that strategic approach to make sure that patients are aware of the costs at the right time when they're searching for them, right? Any other comments on transparency? I know we're about at time. We have about 2 minutes left.
Just that we're Cerner, so we'll be working with Experian on their price estimator. So, but I am interested in Mary Beth's rebalancing because we also do strategic pricing where we look at that on an annual basis. And so are you going to be using your what sort of a tool would you use for that to sort of rebalance? Do you have a sense?
Well, we'll just be looking at our own data, possibly using consulting advice as well. But what you said earlier about alignment with clinical, I think that's going to be key for us to align with our clinical strategy. You know, there's services like behavioral health and primary care that, you know, I think we want to grow in our communities. And those are sometimes also those particular services where, you know, there isn't a financial incentive, unfortunately, for providers to focus more in that area. So I think, you know, approaching it with alignment to our clinical areas, as well as looking at our pricing models and making sure that all those incentives are aligned is the goal, but it'll keep us busy for a while.
One final question, we're about at time. I'd love to hear from each of you in brief, 1 sentence or less. There's a question from the audience. Thank you. What advice do you have for young women interested in leadership in healthcare?
So I'll start. I give the same advice to everyone who wants to be a leader. It's all about initiative. Always take the initiative, volunteer, raise your hand. That's how you start advancing yourself as a leader in healthcare.
One piece of advice that was given to me, and so I would repeat, is to lean in and let your voice be heard. Don't hang back and let others do all the talking, and realize your ideas have value, and be bold enough to share them.
Thanks, Kelly Black. Kelly Searle.
Add value, add value, add value. Just there's always that opportunity, and do it in a way that is authentic for you. One of mine.
And last word goes to Mary Beth.
I would just say have the confidence to, as others said, lean in. And as long as you're being authentic and looking at things in the right way, I think that leaning in and taking the opportunities when you have the advantage to do so would be my advice.
Thanks, Mary Beth. We are at time, so I just want to thank you each for your contributions today, your candor, your great advice, some of the key takeaways for me. I loved hearing about souvenirs from Kelly Searle and how they can really lead to our growth. And you can put them on the shelf and to keep going. I think that's what Mary D said in response to that. Also the value of informal mentorship, challenges really being an opportunity for us, stay calm and carry on. And really boundaries around focusing on goals and achievements and thinking about how we can pivot from COVID and how there's really silver linings and opportunity in this. And it's so great to hear how you all haven't missed a beat and how you all have flexed and adapted so well. Thank you also to the audience for your questions. That concludes this CEDAR discussion, Women in Healthcare. And please keep an eye out for our upcoming CEDAR Talks, everyone. Graham Stanton will be our next CEDAR Talk on January 20th. If you want to learn more about CEDAR and what we do, check out our website, www.cedar.com. I wish everyone a happy and healthy holiday and rest of 2020. Thank you very much.